Hello and welcome to Kano Spotlight. I am Ibrahim Isa. President Muhammadu Buhari has scored 2.9 million votes in the All Progressives Congress APC presidential primaries in the state. On the flip side, Kano State Governor Abdullahi Ganduje has clinched 2.7 million votes to emerge as the flag bearer of the All Progressives Congress APC in Kano State. We'll also bring you our chat with the Commissioner for Health, Dr. Kabiru Ibrahim Geizo, on his achievements. You surely don't want to miss any of this. We'll go on a short break now and return in just a moment. President Muhammadu Buhari and Kano State Governor Abdullahi Ganduje have been endorsed by members of the All Progressives Congress APC in Kano to run for second term. President Muhammadu Buhari scored 2.9 million votes, while Kano State Governor Abdullahi Ganduje clinched 2.7 million votes. Members of the All Progressives Congress APC in Kano at various places in the 44 local government areas participated in direct primaries to elect their candidates for the 2019 elections. President Muhammadu Buhari is the lone candidate for the APC and was voted massively by party members in Kano.
You can see the conduct of these primaries has been peaceful, has been orderly, and with full cooperation of the members of this great party APC. Like you know, it's just a matter of reaffirming that our President Muhammadu Buhari is our sole candidate for the presidential race.
Alhamdulillah, as you can see, people are on queue and everything has been going on successfully. And no any problem, everybody is happy that this thing is taking place today here right now on this day.
Governor Abdullahi Ganduje, who doubles as the returning officer for the presidential primaries, visited Ganduje town to exercise his franchise. He noted that the direct primaries have given members of the party a chance to participate accordingly.
We have chosen to do direct primaries, and this is exactly what is meant by direct primaries, where people will come out physically and people will also be requested to present their cards for the membership of our great party, the APC, which has already been done. So you can see that we have achieved our objective because we intended to provide an enabling environment for maximum participation of our people, and this is exactly what we mean. So we are happy with these presidential primaries, which we have now decided, and we have now elected our presidential candidate Muhammadu Buhari. Like what has been mentioned, the number of people who came here and were enumerated and were counted. We have 5,361 people who are now behind Muhammad Buhari in this Ganduje ward, of which that is what we are expecting.
President Muhammadu Buhari was endorsed with 2.9 million votes. Announcing the outcome of the presidential primaries, Governor Ganduje expressed delight at the development and commended efforts of all stakeholders who contributed to the success.
In respect of the nomination for presidential election come 2019 in favor of Muhammad Buhari, I would like to introduce members of the Congress Committee. The Secretary of the Congress Committee is the Right Honorable Kabir Al-Hassan, who is also the Right Honorable Speaker, Kano State House of Assembly. Members, Senator Barrow I. Jibrin, the member of the committee, Senator Kabiru Ibrahim Gaya, member of the committee, Honorable Al-Hassan Ado Dogwa, member representing Dogwa and Tudunwada Local Government House of Representatives, is also a member of this Congress committee. And the chairman of this committee, who is also the returning officer for this Congress, is my little self. My little self, Abdullah Umar Ganduji, the governor of Kano State. Now we listen to all the 44 returning officers with their secretaries, one by one, up to 44 local governments. We all had the individual results in favor of Muhammad Buhari, and the total votes in favor of Muhammad Buhari stands at 2,931,235 votes in favor of Muhammad Buhari.
The next day, the APC members were also at the 484 wards in the 44 local government areas of Kano to endorse their governorship candidate. Governor Abdullahi Gandoji was also in his hometown for the exercise.
I'm highly, encouraged, and you see a number of people who are here, thousands of people who gathered here in order to nominate me as the governor of Kano State come 2019. Certainly, this is very, very encouraging. Certainly, this shows that the people of Kano have appreciated what this government has done, especially in the areas of education, in the areas of health, in the area of infrastructural facilities, especially roads, and also in the area of agriculture, in the area of peace and stability, and to cap it all in the area of skill acquisition among our youth. We empower our women, we empower our youth so that they can become self-reliant. We have even constructed a multi-billion naira skill acquisition center in Kano, which is now equipment are being installed. So we are sure that in a very short time, youth will get a center where they will learn some skills and they will be self-employed. I think this is very, very encouraging.
Chief Returning Officer of the APC governorship primaries in Kano, Pius Odudu, announced that Ganduji clinched 2.7 million votes.
From our records collated so far, His Excellency Ganduji won in every one of the wards in Kano. He won in the 484 wards, and of course that means he won in the 44 local government area. He won very handsomely. He has a total score of 2,740,847 votes. We want to congratulate him, as I, on behalf of this powerful committee, declare him duly nominated to fly APC party flag in the 2019 gubernatorial election here in Kano State. We wish him the very best, and we wish him success at the poll.
Addressing party faithful shortly after the victory at the APC Secretariat, the State Deputy Governor, Nasir Gawuna, commended them for their support. He congratulated the governor and assured residents of more commitment to the development of Kano State.
As it's enshrined in the constitution of the party, we have to conduct this exercise. It has been done, and it's been done peacefully, just like the way we have conducted the presidential primaries, which took place 2 days back. And alhamdulillah, from the overwhelming votes His Excellency has scored, it is indeed something of noting that His Excellency Dr. Abdullahi Umar Ganduje is really a person that has been endorsed not only by the party but by the general populace. He has scored 2,740,847 votes.
We now bring you our chat with the Kano Commissioner for Health, Dr. Kabiri Ibrahim Getso, on the achievement of Governor Abdullahi Ganduje in the areas of health care delivery. Welcome back to Kano Spotlight. With me is the Kano Commissioner for Health, Dr. Kabiri Ibrahim Getso, and we'll be discussing issues of health in Kano State. Honorable Commissioner, you're welcome to Kano Spotlight.
Thank you very much, Ibrahim.
When health is talked about in Kano, what are the giant strides of the Ganduje administration?
When you talk of giant strides in the healthcare sector, under the able administration of His Excellency Dr. Abdullahi Umar Ganduje OFR, this is a big question because, I say big question because looking at the number of interventions, number of programs, number of initiatives that have been achieved in the state healthcare sector over the last 3 years of this able administration. So a lot has been achieved. When you are talking of the achievements or the milestones that have been recorded in the healthcare sector under this government, for better understanding, let me break it into segments, looking at specific components of the healthcare sector. Most importantly, when you are talking of health sector, I think the two most important components are human resource for health and health facility infrastructure and equipment. So let me begin by mentioning some of the laudable achievements that have been recorded under the administration of Dr. Abdullahi Umar Ganduje OFR in terms of improving human resource for health in Kano. I'm sure you'll be surprised at what I'm going to tell you. Because it's not a news, we are all aware, the media is awash with the news that and reports from so many states that healthcare workers and indeed other workers are not receiving their salaries as and when due. But in Kano, I want to say that there is never a time that workers are owed salary over the last 3 years. Especially healthcare workers. Healthcare workers in Kano State are being paid as and when due over the last 3 years of this administration. And most importantly, or rather what will surprise you, is the fact that Kano State government has been enrolling, has been recruiting healthcare workers periodically. This is really surprising in this era of economic downturn when governments are not being able to pay salary. Kano State government is adding, more healthcare workers. This is because we need more healthcare workers. We need more staff that will provide quality services to the teeming clients that patronize our facilities in the state. We have people that not only people that are from Kano access our services here, but we have people that are coming from other neighboring states like Jigawa, Katsina, Kaduna, and what have you, because of our proximity to access healthcare services here in Kano State, and also because of the quality of the services that are being provided. Equally, we see clients coming from other countries. For instance, not dwelling on the subject, one of our facilities, Murtala Mohammed Specialist Hospital, if you go there on daily basis, you will see the number of people that are, trooping to that facility to access care. Averagely, we see like 7,000 to 8,000 clients on daily basis in that facility alone. So this is to underscore the importance of having adequate human resource for health in our facilities. We have over 1,100 facilities in Kano. So definitely we need a lot of human resources. So over the last 3 years, Kano State government has recruited over 3,000 healthcare workers who have been posted since to our healthcare services and are already providing services. This include medical doctors, pharmacists, laboratory scientists, nurses, midwives, physiotherapists, and what have you. All cadres of healthcare workers have been engaged over the last 3 years to boost our human resource base in Kano. I can remember late last year, around November, His Excellency Dr. Abdullahi Umar Ganduje distributed offers of appointment to 2,458 primary healthcare workers, who are essentially community healthcare workers that man our numerous primary healthcare facilities that are spread across the 44 local government areas of the state. Equally, during that same occasion, His Excellency distributed offers of appointment to sanitation vanguards who are supposed to ensure sanitation in our environment, along our streets, in our markets, and all other places of human endeavor. This is because of the close link between health and environmental sanitation. Findings have shown that most of the communicable diseases, more than 50% of them, have a link directly or indirectly with environmental sanitation. So environmental sanitation is very key in terms of ensuring the health and well-being of people of any state. Let me also say that Kano State government has prioritized training and retraining of healthcare workers because the field of medicine, the field of healthcare services delivery is very dynamic. Things are changing. We have evolving concepts. We have new procedures that are coming, new findings, new researches that are showing new interventions that are impacting more on the lives of citizens. So there is need to periodically train and retrain healthcare workers. So this is an area that Kano State government has given a lot of priority. So we do on a regular basis train and retrain our healthcare workers so that their knowledge can be updated, so that they can be able to offer quality services to our clients in the state.
Okay, talking about infrastructure, recently the Muhammadu Buhari Specialist Hospital was inaugurated by the President, and we're also made to understand that Zuro Pediatric Hospital is also part of the inauguration by the President. Would like to know at what stage are these facilities working now?
Well, thank you for asking me that question about Muhammadu Buhari Specialist Hospital and Sheikh Khalifa Isiaq Rabiu Pediatric Hospital. These are two mega hospital projects that were started more than 10 years ago, but for one reason or the other, they were abandoned. So His Excellency, because of his concern for the health of the good people of Kano State, directed the contractors that are handling these two projects to come back to site to complete the project so that people of Kano can benefit from specialist services. And like you rightly mentioned, His Excellency President Muhammadu Buhari was in Kano precisely on the 6th of December last year to commission these two facilities. These two facilities, for instance, the Muhammadu Buhari Specialist Hospital in Gijinyu was inherited by this government at about 35% completion state. That is the infrastructure I'm talking about. Now, this infrastructure was modified and completed by this administration to the tune of billions of naira. 65% of the infrastructure work was completed by this government. Then the equipping of the facility was done entirely by this government. Everything, any equipment that you see in that facility was awarded and supplied and installed by the administration of His Excellency Dr. Abdullahi Umar Ganduje, OFR. So also is the same story for Sheikh Khalifa Isiaq Rabiu Pediatric Hospital along Zuro. So these two facilities are equipped with state-of-the-art, latest equipment that you can think of. I always say Kano State has been in existence. Last year, Kano State celebrated its 50 years of existence, the 50-year anniversary of the state. But I want to inform you that over these 50 years, there was never a time that Kano State had a single CT scan machine. Over these years, none of our facilities, we have over 1,100 facilities in Kano, but none of our facilities has a single CT scan machine. Not to talk of other equipment like MRI. And look at the period that we are in. Period of economic recession, though the country is now out of recession. But still, the situation is not as good as it used to be before the coming of this administration. But despite that, because of commitment, because of concern, His Excellency awarded the contract for the supply of this specialized equipment, state-of-the-art equipment, was close to 2 billion naira. And equipment like CT scan machine, MRI machine, mammography machine, digital mammography machine, digital fluoroscopy machine, 4D ultrasound scanning machine, state-of-the-art theater equipment, state-of-the-art ICU, sophisticated ICU equipment, dialysis equipment, and a host of other equipment were supplied, including ventilators, in the ICU, in our pediatric, in the adult ICU at the Muhammad Buhari Specialist Hospital, and also the pediatric ICU at the pediatric hospital, Sheikh Khalifa Isaac Rabi Pediatric Hospital. So you can see the level of sophistication of these two facilities. And all this equipment have been, installed, they have been supplied, and they have started functioning, providing services to the good people of Kano State.
Let's talk about policies of government. What policy has the Ganduje government has when it comes to health care delivery in Kano State? What are some of the policies?
Well, when you talk of policy, a lot of policies have been promulgated by this administration to improve healthcare services delivery. Let me just cite some of these policies. Very recently, Kano State government domesticated the national task shifting and sharing policy. This is one of the policies of the federal government that is aimed to serve as a stopgap measure to address human resource gap in the country. So some of the skills that are not too technical, but that can be executed by middle and lower cadre human resource, by middle and lower cadre staff, are being transferred from highly skilled manpower to lower and middle cadre manpower, because this highly skilled manpower are insufficient. So you want to free up some of their time so that they can be able to deal with more complex cases. For instance, conduct of deliveries. Under this domesticated state task shifting and sharing policy, now the community health extension workers have been, this task of delivering pregnant women has been shifted to community health extension workers, so that even at the remotest primary health care center, a community health care worker can be able to deliver a pregnant woman. For instance, clients that have HIV/AIDS, this is a chronic disease. They used to come to the facility to be seen so that they can be re-prescribed their medication. So some of these tasks have been shifted to these community health extension workers, so that, like I said, the time of highly skilled workers, can be freed so that they can be able to attend to other more complex cases. This is one. Then, recently, Kano State government established 2 new agencies. The Kano Health Trust Fund Agency is actually a scheme that is meant to, get additional resources outside the budgetary allocation for funding healthcare sector. So this agency has been established by law that was, drafted by the State Executive Council. It's an executive bill that was sent to State House of Assembly for passage into law, which was done, and His Excellency has assented to the law, and the agency is now established. So by that law, the state is going to be remitting 5% of its IGR on monthly basis to a dedicated account. Equally, the 44 local governments are going to be remitting 1% of their monthly statutory allocations to the same account, so that the funds would be used to improve healthcare services delivery. Then there is another agency that is established by law, the Private Health Institutions Management Agency, which is meant to improve management of private health institutions in the state. We have many private health institutions in Kano, and surveys have shown that majority of our clients, they patronize private health institutions. So there is the need to ensure that these private health institutions are operating according to the laid down rules and regulations. So an agency is set up by government as a policy to regulate and supervise the practices of these private health institutions. Additionally, there is the state contributory healthcare scheme that is established by Kano State government, which is meant to ensure to improve access to healthcare services in the beginning by the formal sector, by civil servants, but what we are intending to do is to expand it so that every member of the community can enjoy this scheme. So now, over 200 facilities have been registered. Government, public facilities and private facilities have been registered under the scheme. And now civil servants that are registered under this scheme do not have to pay for services at the point of need. I was just informed last week there was a civil servant that was involved in an accident and he sustained fracture. He was taken to Dala Orthopedic. He was charged about 900,000. So you can see how huge the cost of medical care is. But this civil servant did not pay a penny. The expenses were offset by this agency. So you can see how good this scheme is, how it is making access to healthcare services very easy.
That's all we have for you for this week. Let's do this again next week. I remain your regular host, Ibrahim Isa. Bye for now.